Okay, now that we've talked about mutations, we can start talking about genetic testing, which is how we detect these mutations, what they mean for our health, and even how we might treat genetic disorders using gene therapy. So we'll start with genetic counseling. So this is a really important process where potential parents will meet with a trained counselor to kind of understand the risk of passing on inherited conditions. It's about helping people make informed and sometimes very emotional decisions. So the counselor will explain how a disorder is inherited, what the medical consequences might be, and what options the couple may want to consider, so including testing or assisted reproductive technologies. One of the first tools used in genetic testing was karyotyping. So this is a visual layout of a person's chromosomes that are arranged by size, shape, and banding pattern. And you can think of it kind of like a picture of everything that you have. And it helps us see large-scale abnormalities, so things like missing or extra chromosomes, translocations, inversions, and a variety of other things. So karyotypes can be made from adult white blood cells or leukocytes, or even from fetal cells that we've obtained either from an amniocentesis or from a chorionic villus sampling or a CVS. So an amniocentesis involves collecting a sample of amniotic fluid from around the fetus, usually between the 14th and 17th week of pregnancy. There is a small risk of spontaneous abortion, about 0.6%, but it provides important information about the fetus's chromosomes. So CVS, on the other hand, is going to collect cells from the developing placenta, and it can be done much earlier, so as early as the 5th week. The trade-off is it carries a slightly higher risk at about 0.7%, but gives results sooner, so it can be helpful for making time-sensitive decisions. So this is showing you the karyotype over here and what it looks like. So chromosomes don't tell the whole story. Some genetic disorders are actually caused by faulty proteins, especially missing or malfunctioning enzymes. So for this reason, we might want to test for the presence or the quantity of an enzyme itself. Another approach is to go straight to the DNA. So one method looks for genetic markers, which are recognizable abnormalities in the DNA sequence that were caused by the presence of a mutant allele. When you cut the DNA with a restriction enzyme, the resulting fragment pattern will look different from someone without a mutation. We can also use DNA microarrays, which are just tiny silicon chips that are dotted with sequences representing known mutant alleles. When you compare a person's DNA to this chip, it can reveal whether they carry variants associated with diseases like cancer or even heart disease. So this is a powerful tool in predictive medicine, and it helps, and it often is followed up with some sort of discussion with a genetic counselor to help interpret the results and then consider the next steps. So going even further, we can have DNA sequencing, where we read a person's entire genome. And this has really become a cornerstone of personalized medicine. And this kind of testing can not only assess disease risk, but also tailor treatment plans to the individual's genetic makeup. So for example, knowing how a patient metabolizes a drug can help doctors choose the right medication and dosage. So as costs drop, full genome sequencing is becoming more widely available, and it's changing really how we approach healthcare altogether. So let's shift to how we test during pregnancy. So the most often method is to use an ultrasound, which uses high-frequency sound waves to produce images of the developing fetus. It can help identify anatomical issues like neural tube defects or heart abnormalities. If we want more detailed information, though, we can test fetal cells from the amniocentesis, like we talked about, or CVS. Or more recently, we can collect fetal DNA from the mother's blood, which is a non-invasive method. and then use PCR, which we talked about previously, the polymerase chain reaction, and scientists can amplify those tiny amounts of fetal DNA to help screen for genetic disorders without any risk to the baby itself. Then there's embryo testing. So this is used in vitro fertilization, or IVF. And here the doctors can remove a single cell from an embryo at an early stage without harming it. And this lets the parents kind of screen for genetic diseases before implantation. And there's also egg testing, where polar bodies, which are the byproducts of meiosis, are going to be examined. So since these contain the alleles not passed on to the egg, they can give insight to whether the egg carries a defective gene. So if the polar body has a defective allele, the egg itself must be normal. So now what happens if someone has a genetic disorder? So that's where gene therapy comes in. Possibly the most futuristic part of this whole conversation. It's a relatively new field. So gene therapy is the insertion of genetic material into human cells to help treat or correct a disorder. So there's two main types of strategies. We can either use ex vivo or in vivo. So ex vivo gene therapy happens outside the body. For example, in treating severe combined immunodeficiency, or SCID, bone marrow stem cells are removed from the patient, infected with a retrovirus carrying the correct gene, and then returned. So this idea is to fix the problem cells and then let them do their job. This approach has also been used to treat family hypercholesterolemia, which is a disorder causing dangerously high cholesterol. So doctors remove a small portion of their patient's liver, infect it with a virus carrying the healthy gene for the cholesterol receptor, and then return the tissue to the body. Here's an example showing you what we just talked about. So in vivo gene therapy takes place inside the body. One example is a treatment for cystic fibrosis, where the correct gene is sprayed into the nose or lungs using a virus or a lipid-based delivery system. Another is for people with poor coronary circulation. So scientists can inject genes for vascular endothelial growth factor, or VEGF, to encourage growth of new blood vessels. And in rheumatoid arthritis, where the immune system attacks the body's own tissues, anti-inflammatory genes can be delivered using adenoviruses directly into the affected joints. So from testing fetal cells and sequencing whole genomes to reprogramming cells with corrective genes, we really have come a long way.